Thank you, and thank you for joining us today. We're at the Arkansas Heart Hospital for the premiere of our Heart to Heart Facebook live panel discussion. Today, our experts will be answering your questions about COVID and heart disease. Our panelists include internal medicine physician Dr. Peyton Card, who has led our COVID unit, cardiologist Dr. Gary Nash, and director of our rehab program, Amanda Sesuda. So please drop your questions in the comments. We chose this as our first topic because a recent study found that people who've experienced COVID are 70% more likely to experience heart failure. As Arkansas's leading heart hospital, we find this alarming. So Dr. Nash, I'm first going to ask you, can you share more on what this study has found?
Sure. So this was a VA study. The dates of the study were from March of 2020 till January of 2021. So this would be the original strain of coronavirus that we're talking about. And it didn't just look at heart failure, it looked at any cardiovascular outcome. So that's rhythm problems, strokes, heart attacks, pericarditis, heart failure. And across the board, you were more likely to have these disorders if you had coronavirus, and the risk followed you for an entire year. Heart failure, it's 70% more likely. The specific number on that was 12 per 1,000 people. The number for any cardiovascular disorder was 45 per 1,000, which, when you put it that way, it sounds a little small. For the 800 and something thousand Arkansas patients that have been infected, that would be 30, I think I calculated it, 37,000 more cases of any heart disease in the post-COVID population than would otherwise have been affected by heart disease.
Thank you. That's helpful information. Dr. Card, can you tell a little bit about the people who are more at risk for heart disease and heart complications after COVID?
Sure. And so I think one of the more alarming things that I remember seeing from the study is that it really didn't discriminate based on they went through the data on the study and tried to split things up how we classically do in medical studies, by like age, comorbidities, race, gender, things like that. And really across the board, when accounting for all of those things, everyone was at an increased risk.
Wow.
Really the only things that I remember seeing that really had a nice correlation is it had to do with how acute or severe your disease was. Mm-hmm. So if you had a mild disease at home where you felt bad for a few days, your risk would be less than a patient that was like in the ICU with COVID a few months ago. And so it kind of correlates with how severe your COVID was.
Yeah, still across the board, even for young healthy people or old sick people, still an increased risk.
That's really alarming for sure.
Yeah.
Dr. Nash, I'm going to throw it back to you. Can you tell us why and how COVID affects your heart? If you can go into a little bit of that.
Sure. So COVID is a coronavirus, which, the common cold is also a coronavirus. The thing that sort of separates COVID from most of the other coronaviruses that, we've all had several times in our lifetime is that it's not just the upper respiratory tract. So it can affect almost any organ system: brain, heart, lungs, gut, pancreas. And so we see, all of it, not just cardiovascular problems, but increased incidence of diabetes, brain fog, all these things after a coronavirus infection. The reason that happens, we're not really sure. It hasn't been around long enough to have a definitive study on that. It could be that in some people the virus just hangs around longer and the viral replication and cell death, including in the heart, causes trouble. It could be just the immune response and the inflammatory reaction, being overreactive, causes problems. We really don't know.
Gotcha. Thank you. Amanda, I'm going to turn over a question to you. You work with these patients right now in our rehab program. Can you tell me just a few of the side effects that you've seen in these patients after COVID?
Most of the patients that we're seeing right now come in with shortness of breath, fatigue, headaches, lingering cough, a lot of exercise intolerance or post-exertional malaise. So doing your ordinary things and getting really tired for a long time afterwards. We're seeing a lot of that.
Yeah, that makes sense for sure. Is it possible to resolve some of this through rehab and help?
Yeah, for sure. That's the purpose of the pulmonary rehab program, is to help address some of those symptoms and reduce some of those symptoms. Now, the purpose is not to cure disease, so we're not promising that we're going to resolve any lung disease or heart disease in these patients, but be able to help them tolerate exercise better, be able to improve their quality of life.
Wonderful. Amanda, can you tell us a little bit about our program, how much it costs, how do you get into our program, do you need a referral, and just the logistics of it?
As far as the referral, yes, it is a supervised, medically physician supervised program, so it does require a doctor's order. It doesn't have to be the doctor that was involved with the COVID diagnosis or treating the patient for COVID. It could be cardiologist, pulmonologist, a PCP. Once we get that order, we contact the patient and schedule them for an initial evaluation. That's kind of the first step. That's one-on-one with one of our nurses or exercise physiologists to get to know their medical history, really assess what symptoms they're having, because every patient that we're seeing comes in with a different set of symptoms. So what are we really addressing? Having them do an exercise tolerance test, keep an eye on their heart rhythm, their oxygen levels while they're exercising, and build their exercise prescription from there.
So someone who's watching this and says, you know, that's me, I've had it, I'm having these issues, what can they do to right now? Can they find out information from our website or contact you, or how do they need to do that?
Yeah, absolutely. So anyone can send us an email. It's stronghearts@arheart.com. There's quite a bit of information on our website, arheart.com. Our phone number is 501-978-3780. We're happy to help facilitate getting any orders from a physician too, and anything that it takes to help these patients. But really they need to talk to their physician, make sure it's right for them, and get an order sent to us.
Wonderful, thank you. You're doing some great work over there. Dr. Nash, I'm gonna throw a question to you.
Yeah.
So one of our viewers has asked, if I've had COVID, should I get a heart checkup immediately? How soon do they need to get a heart checkup after COVID?
Not necessarily. I mean, if you had a mild case and you feel fine and you feel like you've totally recovered, you're probably okay. Now, if you have lingering symptoms, cough, shortness of breath, chest pain, swelling in the legs, things like that, then yes, you want to see a doctor and get checked out for that, and possibly get referred to us.
I have another question. One of our viewers has asked what kinds of tests should be done to check and see if COVID has affected your heart. If anyone wants to answer that too.
So it spans the array of every cardiovascular disease. Like I said, rhythm problems, heart attack, strokes, blockage, blood clots, and so what tests you get really depends on your specific symptoms.
Makes sense. Dr. Card, so how soon will you have these symptoms after COVID? Like, how can you tell that I might be having heart issues?
So the kind of the frustrating thing from the medical side of things about COVID is how different it is in everyone. And so, some patients that we see just have like symptoms that they had during COVID that have just continued and are still bothering them several weeks out. But we do see patients sometimes that, if it's even if you started feeling better for a week or two after you had COVID, maybe then you have started noticing that you're having these difficult issues with like breathing and, like Dr. Nash was saying, like chest pain or new swelling in your legs or things like that. And those would kind of be the red flags that we would recommend getting looked at.
So something like our Keep the Beat program, would you recommend that, or they come and get a full checkup?
So I would say if you're, our Keep the Beat program is, I would say typically for more of like a screening purpose, for patients to be able to see if they have any heart disease or cardiovascular disease that they weren't aware of. If you're actually having some of those symptoms that we discussed, I think it'd probably be better to probably skip that and actually come see one of our providers.
Oh,
For
okay.
sure.
I see. Gotcha. Well, if you're just tuning in, let me again introduce our experts here. We've got Dr. Card, Amanda, who's the director of our rehab program, and then Dr. Nash. And they are answering all your questions about COVID and heart disease. So, Dr. Card, one of our viewers just asked if our vaccines can cause heart disease.
So that is a very hot topic, and I know it has been really since all the vaccines came out. There has been a little more time since all of that came out now to have a little data to look back on. And there is a slight risk with the vaccines of having like myocarditis or things like that. But when you look at the risk of that versus the risk of having a bad outcome with COVID, it's not even comparable. Like the risk is so much smaller to have any complications from the vaccine that it's like overwhelmingly worth it to get the vaccine to try to prevent a severe case of COVID and some of these potential after effects like we're discussing.
Yeah, well, what I would add to that is, besides an allergic reaction to the vaccine, there is no complication from the vaccine that's not a potential complication from the virus itself. And so the incidence of those things are higher in patients infected with the virus than any patient that has gotten the vaccine.
Okay, that's great news. So either Dr. Nash or Dr. Card, if someone is experiencing high blood pressure after having a severe case of COVID, should they see a cardiologist? Is this a warning sign?
For high blood pressure in the absence of any other symptoms, that's bread and butter for your primary care doctor. Start with them, let them get you checked out, and we're always here if they feel like you need a referral.
Thank you. Dr. Carter, Dr. Nash, so what are just the basic signs of like a heart disease that are most common that we should look for just in everyone's life, even if they've had COVID or not?
Sure, I can take that one. So heart disease spans a wide array of disorders. So, we can start with blockage in the heart arteries or heart attack. And sort of what everyone pictures there is Fred Sanford, clutching his chest, "I'm coming, Elizabeth." It's not always quite that dramatic, especially in women. Your typical signs or symptoms of blockage in a heart artery or a heart attack are going to be chest pressure or heaviness or tightness. People say chest pain, but that's sort of a misnomer, more chest discomfort. That may radiate to jaw or back, usually associated with shortness of breath or sweating or nausea. When you talk about heart failure, you would notice swelling in the legs, trouble breathing, lying flat, weight gain. If you're talking about a rhythm disorder, there would be heart racing or palpitations or heart skipping or fluttering sensation. So symptoms can really vary depending on what problem you're talking about.
Thank you. That makes sense. Can you, y'all talk a little bit about how we can prevent some of these symptoms and heart disease altogether? So prevention, how we can prevent some of these issues.
So, a lot of the things, especially if you start early in life, a lot of these things can be prevented to a certain extent. And really talking with your primary care doctor early on, getting established, and keeping an eye on things like your cholesterol and blood pressure, making sure you don't have diabetes, and quitting smoking if you're a smoker. Those are all things that are really important to try to minimize your risk. Occasionally people have genetic things that might trump all of that, but diet and exercise always helps a good bit as well. And just trying to get ahead of all of that to try to prevent things from happening as much as possible.
Thank you. Amanda, talking about the rehab program. So how many people have you treated so far? And what kind of successes have you seen through that for patients?
For the post-COVID program, we've had this Medicare just approved this program in January. So we're a little over 12 weeks, which the program lasts about 12 weeks for most patients. So we've just seen our first few patients. We graduated 5. We have about another 25 patients that are in right now. We've seen really good success. Our first patient graduate was a 34-year-old who was relatively healthy, exercised every day before she got COVID, ended up being hospitalized, shortness of breath, on oxygen, came to us, and within 9 weeks, she didn't even make it through the whole 12-week program, because by 9 weeks, she was back to exercising as much as she was doing before she had COVID. Her shortness of breath, she completely came off oxygen, shortness of breath improved, and so that's what we're seeing a lot of. We have a patient right now who started with us, couldn't finish 1 lap around our track without her oxygen dropping to around 80 and having to be supplemented with oxygen, taking a break, and now she's up to 6 laps, and that's just limited by leg pain because she hasn't been able to walk that far in almost 2 years since she was originally diagnosed. And so that's the good stuff.
That's exciting. Yeah. Very exciting. I think that should give a lot of people hope that this is not, the end for, COVID, for your things that you love to do is not over. Okay, we're looking at some questions here. We know that it's the best to see patients and their full medical history before giving advice. We have a question from someone who had COVID pneumonia, heart and lung failure, and is now experiencing stiffening of the lower heart. Can that be reversed or lessened? And is there a way to provide and bring oxygen levels up?
It sounds like they're talking about diastolic dysfunction, so not necessarily systolic heart failure. When you talk about heart failure, usually people think of a weak heart muscle, but a stiff heart muscle can also be considered heart failure or cause heart failure symptoms. Usually things that go along with that would be like high blood pressure, obesity, sleep apnea. So you definitely want to be treating those sorts of things. How long that's going to last after a hospitalization for coronavirus, we're not really sure, but as many of those other things that you can control and optimize, I think gives the patient the best chance for recovery. And again, plug in, COVID pulmonary rehab. I think if this is a, COVID long hauler, so to speak, exercise is great for diastolic dysfunction.
Thank you for that. Amanda, you were saying we've seen some great success through the post-COVID pulmonary rehab program. have you seen most of these patients being able to go back to their normal lives and live a normal life, doing the activities that they like, playing with their kids, grandchildren? Have you seen that a lot?
So far, yes. That's what we've seen. Now, we're not naive. We know that we're not going to. There are some patients that are coming to us that have probably permanent damage that's been done to their lungs. But we can see improvement in quality of life and helping them get back to do the things that they love to do. So while their disease may not go away, their symptoms are improved, their exercise tolerance is increased, and they're able to do more.
Thank you. That's very exciting. So again, if you're just turning in, we've got our heart disease and COVID experts right here. We've got Dr. Nash, Dr. Card, and Amanda, who's director of our post-COVID pulmonary rehab program. So each of you serve our hospital in different departments. Can you tell if you're able to care for patients?
I feel like something that we strive to do our best at here at the Heart Hospital is for everybody to stay plugged in from like one department to another. No matter if you're in the clinic or our main hospital or down in Encore in Russellville at some of our other places, we all are very plugged in with each other, and all of our computer systems talk and everything like that. And so if you're one of our patients in one of those areas that needs to get plugged in, like with our pulmonary rehab or with Dr. Nash and them in the cardiology clinic, or if you need to come into our main hospital to be treated for something, we try to be as easily accessible as possible to all of the surrounding facilities and the surrounding hospitals.
Absolutely. I know, Dr. Nash, you travel. So what areas do y'all see in Arkansas?
The Heart Hospital network covers the majority of the state. I mean, maybe excluding Northeast and Northwest Arkansas, like the Fayetteville and Jonesboro area. Central, North Central, and Southern Arkansas. If you live in that area, we've pretty much got you covered. We have 30 satellite clinics, I think. All of us travel to a handful of them. For me personally, I'm in Helena, Russellville, and Malvern, plus Little Rock. But if you're in North Central, or anywhere in Southern Arkansas, we've got a clinic that's accessible to you.
Thank you.
And I'll just add the pulmonary rehab program, and we do cardiac rehab too. And we have 4 sites. So here in Little Rock at our new Encore Hospital in Bryant, and then in Conway and Russellville.
Can you expand on a little bit of our cardiac rehab program?
Sure. We see patients post heart surgery, so CABG, any stenting procedure. We see patients that have congestive heart failure or stable angina or chest pain. Any valve repair, replacement, any type of heart surgery. See those patients after their procedure. See them again for about 12 weeks, 3 times a week, and work on exercise tolerance, so progressively increasing exercise with those patients. In many of those cases, we can actually help reverse heart disease. We do a lot of diet and live cooking demonstrations with the patient, nutrition consults, work a lot on patient education about their medications and about lifestyle factors. And so really addressing kind of everything that got them there to that procedure and helping them both recover and hopefully prevent any future procedures.
I'll just add to that, for exercise in general, there's almost no chronic disease that exercise doesn't help. I mean, the old saying, exercise is the best medicine, is true. So if you've or having a heart attack, or acutely infected with coronavirus. Obviously, exercise is not right for you at that moment. But in the recovery phase of those things, and with any of these chronic diseases that we see, exercise can help you in ways that no other medicine can.
Do you have to be a patient here in order to do the cardiac rehab?
No, absolutely not. Any physician can refer a patient to us, either for cardiac or pulmonary rehab.
Mm-hmm. So do we have patients usually across the state that come here?
Absolutely, from all over the state. We actually do virtual cardiac rehab too, and so that's something that is new that started with the COVID pandemic, where patients come in for a face-to-face visit. We give them an iPad and set them up on a program where they log in and see our live education, the live cooking demonstrations that we're doing, and then they work with an exercise physiologist who walks them through the exercise that they're doing at home. And that program has been really successful, even more so than we ever thought, because it's teaching the patient how to do that exercise and change their lifestyle from their home setting, without having to worry about the transportation issues and some of those other barriers that we see to getting patients in.
That's
I
fantastic.
think that's worth emphasizing. So we actually provide the patients with an iPad, so all the equipment they would need.
All the equipment that they need, it has built-in internet, so
Yeah.
we kind of address that too. They log in 3 times a week, just like our patients come in to see us 3 times a week, and they get the exact same treatment. So work with the same team of exercise physiologists, dietitians, chefs, nurses.
That's great.
Wow, that's exciting. That's great for people who live in rural areas, small towns in Arkansas. So that's exciting. Maybe Dr. Card, you can answer this. We've had a viewer that asked if I have had COVID but had none of the symptoms that y'all described, should you still get checked out?
I think if you had especially a mild case of COVID and feel like you've completely recovered afterwards and are not having any of these symptoms that we're talking about, you're probably okay to kind of get back to normal and try to live life again.
Great. Okay, so any of y'all can answer this question. What are some of the most exciting or innovative procedures and treatments we offer here at the Heart Hospital?
Wow.
Mm.
Anything that come to your mind? I mean, there's always great things happening all the time, so.
We're privileged here. We're one of the highest volume cath labs and ORs in the country, so we typically are the go-to for most of the industry for the latest and greatest equipment, and for the span of cardiovascular disorders, rhythm disorders, heart attacks, blockage, heart failure. So I mean, I'm a plumber, so I like all the newest interventional cardiology stuff, but I'm sort of biased. But we're cutting edge on it with any cardiovascular condition here.
Mm. Anything y'all want to add to that? I think Dr. Nash summed that up pretty good. Okay. We really appreciate everyone for tuning in to our first Heart to Heart Facebook Live panel discussion on COVID and heart disease. We hope you have a great evening, and thank you very much.